Yes, fantastic. Lovely to see you and Happy New Year.
And same to you. And how are you?
I'm doing okay, thank you. I was just saying it's really, really cold here. We've had more snow. It's very icy. I ended up falling over on the ice this morning when I was walking my dog. So I've got a lot of bruises down the side of my body, but
Oh,
I'm
bless
I'm
you.
doing okay.
Yes, you need to be so careful, don't you? The black ice is incredibly
Ah,
slippery. I went under my car once just trying to come out in very slippy shoes. And yes, it was a bit tricky. We had lots of lovely snow, a couple of episodes of lovely snow. And then it's just chilly. But I love walking in the rain, but not to fall over. So yeah, grippy boots.
yes, yes. Fortunately, no one saw me, so that's one thing.
As
Well, I
long
hope
as
they
you're
didn't.
all right and nobody can help you up. Oh, bless you. We've got to be so careful. I mean, we don't want to fall over at sort of any age, but it's falling over is such a big thing, isn't it? When you're older, it's everyone falls over a lot when they're younger, but when you're older, it's an enormous thing, and then you risk fracturing or taking out your ACL, like I did 3 years ago, and that was a little bit tricky to recover from. So yes, let's
Yes.
not do that. Let's not do that anymore. I'm just, excuse me if I cover a cough. I've got that horrible coffee thing that is going around. Much better,
Yes.
but still can have a little bit of a coughing thing. So all is good.
No problem. Yes, I hope you feel better soon. And we're going to be talking all about side effects of HRT today, aren't
Yeah.
we? Which I was explaining, I suppose, on the practice video, the introductory video that everyone, if anyone was there, I was just sort of saying that it's a really common topic for us to be chatting about with our patients. We see lots of worries about side effects of HRT because people have heard horror stories from their friends or people that they know. It's something that comes up a lot, and I think there's so much to talk about in terms of the different side effects. But certainly, we've always usually got some form of solution. I think is reassuring for people to know. So I don't know if you want to start, Carys, by just sort of sharing, what are the side effects that people can expect to get when starting HRT. I don't know if we should split the hormones um, into
Let,
estrogen, progesterone to start with. Should we talk about side effects with estrogen that women can expect to see?
yeah. Let me go. Actually, I've got a few things here just to help me remind myself. So what we were just discussing is how much there is to discuss here. So if we're going to try and put it into sections, we could discuss estrogen. We could discuss progesterone and synthetic progestogens, which are the other types of progestogen we give to protect the lining of the womb. We could also touch on testosterone if we have time. We could look at actually giving hormones in perimenopause when hormonal fluctuations are happening. We could look at giving them in menopause, and then we could look at how women respond to them quite a long time after their menopause, couldn't we, when we add them back in, and how those can be. We can look at, because we know these hormones travel in the body, in the bloodstream, and they act on receptors in the body. We could look at how sensitive are those receptors. Have they been down regulated or up regulated? And we could also look at progesterone being metabolized, its metabolite allopregnanolone, and its effect on GABA in some women and PMS symptoms. So there's actually quite a lot to look at, isn't there? So
Mm.
if we start with estrogen. So estrogen is the hormone that we're giving you to help with the symptoms of perimenopause and menopause. It's the one that's declining. And we can give it through the skin as a gel, a patch or a spray, or as an oral tablet. And sometimes, and we want that level to be nice and consistent, because high levels of estrogen don't make you feel very well, as low levels of estrogen also can give symptoms. So one of the main symptoms that I might see if I give estrogen, and certainly not for everyone, only some people suffer from symptoms, and we want to stress that for most women, symptoms do get better over time, don't we? So we have to remember that the body is changing, hormones have an effect on everywhere that there are receptors, so it's not unusual to feel a bit different when hormones start to change. So we might get a little bit of breast tenderness and breast enlargement. That's one of the common things I see. And that's particularly common for me in women who we give estrogen in the postmenopause, who have been without it for a bit. And so that's why it's really important to go really super slowly with small doses and build up, just to let your body get used to things. Because going in my experience, with really high doses, and this is I'm not talking about women with premature ovarian insufficiency who have got, a requirement is different potentially for them. I'm talking about usually people in perimenopause and menopause and postmenopause, going in to let the body get used to it. You could also find a bit of bloating. You could feel a bit sick. You might get headache or worsening migraine attacks, and you might get some cramps in the legs, and you might get some bleeding because estrogen thickens the lining of the womb. So it's really common to get a little bit of bleeding that you weren't expecting in the first 3 months of starting estrogen as a hormone. So those are the ones that I see. What about you, Rachel?
Yeah, I think they're certainly the commonest ones, aren't they? I think occasionally we might see a little bit of increased anxiety,
Yeah.
don't we? Particularly if someone's, in perimenopause and we're just starting the HRT, the estrogen, and they've not been on it sufficiently enough for things to sort of get into a rhythm or get into a little bit of balance. So I'm sure, both of us, we always ask women about their sort of medical history, their mental health history, and if we get a sense that somebody might be quite sensitive to sort of hormonal changes, if there's somebody that's experienced hormonal anxiety, changes in their mental health through their cycle in the past, or seem to be very sensitive when they've started various types of hormonal contraception, perhaps we go a lot more slowly, don't we, in terms of the dosing often. We try and preempt that by going at low doses if that's appropriate.
Yeah.
And making sure that we're giving people plenty of time for their bodies to adjust and get used to the HRT being there before we increase up the dose. So yeah, that's I think probably the other commonest one that I see. And like you say, I think a lot of it's about the body just getting used to having something else there, slightly different hormonal balance. And for the majority of women, these side effects do settle down, don't they? By sort of month 2, month 3, we start to see that things are a lot more manageable. And actually, the majority of times they do disappear, don't they?
Yeah.
And we've got plenty of tricks up our sleeve and suggestions for when they don't. But before we talk about those, should we talk about the side effects that some women might get with progesterone?
Yes.
And I'm saying
What
progesterone and I'm meaning a
the
whole
whole
host of different things,
Yes,
aren't I?
exactly. So and one thing we might also want to add in with the estrogen is that sometimes it can worsen allergies, can't it? Cause an increase
Yeah,
in histamine. So that's something that we're now seeing, and it's really important to have good. So when we're taking estrogen into the body, we've got to then use it, haven't we? We've got to activate it, and then we've got to excrete it from the body. We don't want it to be there forever, so we've got to get it, and it's excreted via the gut. So we've got to also remember having good gut health, because our gut microbiome changes as we go through the perimenopause and menopause to be more like a male, and the bacteria active in the gut may change, and those get rid of estrogen, don't they? So we want all those sort of are part of our excretion process. So we want to have really good gut bacteria, and some people with histamine problems when they start to take estrogen need to have specialist, I think, a really specialist consultation about that,
yeah,
with somebody who's really experienced in it, in order to help really look at your nutrition and gut health and your stress levels, because don't forget, estrogen's one hormone. We have lots, maybe 50 or so hormones in the body. They don't work just on their own. They can have effects on other hormones. So all our sex steroid hormones, so estrogen, progesterone, testosterone, come from cholesterol, as does cortisol, as does our sort of salt balance hormones. So we have lots of different hormones working in different ways together, don't we? And receptors that sometimes one hormone can work on one receptor and another one as well. So have different side effects for that. So progesterone. So when we prescribe progesterone or a synthetic progestogen in perimenopause and menopause, we're adding it to your HRT. We're going to choose it. They're not all the same, are they?
No.
So progesterone is made from your own ovary after ovulation. The egg pops out, the little eggshell in the ovary is called the corpus luteum, and this makes progesterone in the second part of your cycle. And the corpus luteum lasts about 12 to 14 days. Then it starts to degenerate. It makes a bit of progesterone and estrogen. And when it degenerates, if you don't become pregnant, it falls. And that's your own natural progesterone. So micronized progesterone, Utrogestan, as is in the UK, or Geprotix, we also can provide, are little tiny capsules. They are taken at night, usually, because they're quite sedating. The dose depends on you. So in perimenopause, it's given for part of the month. In menopause, it's given all month. Sometimes that's different depending on your own medical conditions, but generally that's the case, isn't it? And so if you're looking at having side effects, or how you're feeling on the hormones, what's important to think is, how am I feeling when I'm just taking estrogen, or how am I feeling when I'm taking both the hormones, if I need both? And progesterone is needed to protect the lining of the womb from the thickening effects of estrogen. So it can make you feel a bit, it can give you premenstrual syndrome type symptoms. It can give you mood changes. It can give you headaches like estrogen. It can make you retain fluid and be a bit bloated. So sometimes it's a bit difficult to work out which hormone it is that's causing the troubles that you may be suffering temporarily, hopefully, from. Now, when we're looking at giving synthetic progestogens, they also act on different receptors in the body, like the glucocorticoid receptor, like the mineralocorticoid receptor, and that means a steroid, and the salt balance receptors. So we might find a bit of bloating and a bit of weight gain. If they act on the androgen receptors, we might find a little bit of acne, a little bit of excess hair growth, a bit of oily skin. So it depends on which type of synthetic progestogen we are giving you as to what sort of symptom side effects you might experience. And it depends on how they are metabolized. Now, it's impossible and ridiculously complicated to explain it all on something, on a podcast, and it is not necessary. It's up to us to try and work out, okay, which one would work best for you, which one is really good at controlling bleeding, which one may not be, which one might help you sleep, which one might be really good, in a Mirena coil. We've got which one would be best to help you control your bleeding in that way. So there are tricks up our sleeve, aren't there, to choose ones that we think will suit you best, that are safest in the risk profile for you, because they have different risks with blood clot, they have different risks. We think they have different risk. According to observational data, we think there is a difference in risk of breast cancer for the first period of time that you're taking HRT. That's observational data. And we think that there are some that have slightly less risk of breast cancer than others. But I think there's a lot of data that we need to get, isn't there? So essentially, there are a number of different types. They act on different receptors. Some people love them and can't wait to take them a lot and more and more. Some people are not so keen. And for some people, they genuinely don't get on with them very well at all. And they make them feel really very unwell and can give premenstrual syndrome and PMDD type of symptoms. So a small percentage of people are intolerant to progesterone, and we've got ways of working with that, haven't we? So ways of trying to try different ones. Maybe we try taking them in a different way, but we do need to make sure the dose is balanced to the estrogen dose, and that we are not putting somebody at risk when we're prescribing thickening of the lining of the womb through not giving enough progesterone. So we've got to try and find the right one that's suited well and give enough time for the body to respond, because when you put something new in, it can take a bit of time, can't it? So that's my experience. We usually get there, but it can be a bit of a trial and error. And what I've started to say now is, let's have a trial of doing this. let's see how your body gets on with it. And very often your body will do really well, but it's something new, so your body doesn't know what it is yet. So we've got to just wait for things to balance. What do you think?
Yeah, it's all about individualizing it, isn't it? And it's all
Yeah.
about sort of getting that feedback from how people respond initially, how things do over time, what the context of their medical history and their other risk factors are, what their past experience of hormones is, and I think also really importantly what the environment for those hormones is like. So what are the foundations around, gut health, stress, sleep, environmental stress and factors there, because we can put all the best hormones in, can't we? But if then, like you say, not being metabolized, or there's too many other competing factors like high cortisol and that's affecting the balance of hormones in the body, then it's going to be harder for those hormones to settle in, and sometimes that can make people more likely or more sensitive to experiencing side effects. But having said that, I've also got lots of patients that don't have any side effects
Yeah.
at all, don't you?
Yeah.
I'm
Yeah.
always, sometimes it's the people that I'm expecting to get lots of side effects that we're really
Yeah.
pleasantly reassured about. So I think we're talking about side effects today, but not in a way to scare anyone or put anyone off, because like you say, there's usually ways that we've got of working with this, and just because somebody has tried some HRT, just maybe you've been given some HRT by your doctor, your GP for example, or whoever has prescribed it, and you feel like you're not getting on with it, or maybe it's not controlling your symptoms. This is where it's so important to go back and talk to your prescriber, because actually a lot of the time there's various things and suggestions that we can make, and lots of the time we do get there, don't we? The
Oh,
majority of the time we do get there with people. It does just take a little bit of time, like probably you say, we don't go into perimenopause overnight, so actually it we not overnight that we're going to get a complete cure, if you like. Actually, things do just take time. We need to see how somebody responds, try little experiments, if you like, to in informed experiments to see how somebody's body responds to the hormones, give them chance to bed in,
yeah.
don't we?
Yeah.
So
Definitely.
I'm usually sort of very hopeful, that actually there's various options available for women, and not being put off trying HRT just because you might be worried about side effects, which is what I hear so often. See so many women too scared to try it because they've heard various bad experiences, which some people do have, unfortunately, and that puts them off trying it, even though they would really like to in other for other reasons. And I think this is where the benefit of speaking to somebody who is experienced in prescribing HRT, navigating perimenopause, menopause, surgical menopause, whatever your situation is, so that you can get that individualized advice. And the other thing that we were talking about, wasn't it, earlier, was the importance of perhaps tracking any side effects or symptoms, weren't we?
When you have, yeah, depending on which hormones you're actually taking.
Um,
Yes, absolutely.
um, because particularly if you're on what we call sequential HRT, where you're taking estrogen through the month and then you're using a progesterone or a progestogen in part of the cycle, it's really useful information for you and for us to know when those side effects are and when those side effects are worse, because that can help us to ascertain A, which hormone is causing the side effect, and B, give us that information so that we can make appropriate changes or tweaks. That's probably one of the things that I would recommend. Keep tracking your cycles, your symptoms, even after you've started HRT, just to help that process along. And Carys, when should somebody speak to their doctor if they're experiencing side effects? How long should you leave it? I know we normally always recommend a review after 3 months of changing or starting HRT, but what else would you say from that perspective? When is it important to discuss with your doctor?
So I always say we review after 3 months after starting, and then we also review 3 months after making a dose change, just to make sure that we're all okay. Now, as long as things are gradually okay, your quality of life is still okay, things are improving, but you're noticing some changes, that's fine to wait and see and let your body adjust. But if you are really experiencing severe mental health problems, we wouldn't want you to wait. So for those very few minority of women that do experience really severe mental health problems when they have different types of hormone introduced, then we would want you to seek help really, really quickly with that. And I think what you've said there is really important, because I've had, and I know I'm sure you've had as well, patients where it's just taken time of trial and error, and actually we get there in the end. And I've had a 2 or 3 recently where it's just been such a joy to get to the right place in the end, but it has been a journey. And during that journey, sometimes they start HRT and some symptoms settle, and then they may get other symptoms. And then as things gradually, you find the right thing for them, and they find the right thing for them, they do find a place where things just seem to settle down and feel very much better than they did. And I think we have got to remember perimenopause is a fluctuating journey. We can add HRT to that, but that doesn't switch off the fluctuations of the ovary itself. Some people, we would use potentially the combined contraceptive pill in perimenopause to try and stabilize things, but many women feel well with a small dose of HRT just to stabilize the low hormonal dip. And it is HRT will help reduce the symptoms. Certainly, it's the most effective treatment for vasomotor symptoms, but using it in conjunction with lifestyle is so much better than just using it on its own. And sometimes when I speak with patients, there's usually something that we can improve in the lifestyle to make things better again. So things like smoking will make symptoms worse. Having excess body weight may make your vasomotor symptoms worse. Not exercising, for example, or really heavy intensity, high intensity exercise might actually not be helpful for you, and actually low intensity, more calming exercise, certainly with strength, will be helpful. Going to bed early, not going to bed, not going to bed early, but going to bed and making sure you've got good time in bed to allow yourself to sleep, really, really helpful. Eating good nutrition. Sometimes when you're feeling really unwell, the last thing you really turn to doing is actually looking after yourself, isn't it? But actually, that's so important, because it's not just the hormones that we give you that help with the symptoms. It's a good level of vitamin D. It's a good adequate level of zinc and magnesium and protein, and a balanced blood sugar and a good gut microbiome. There's all these things to consider, which are not difficult, but certainly something to help. And even something as simple as a morning walk, just to try and balance, your cortisol and your melatonin in the morning. So we can give the hormones. My approach is usually to go slow and let the body get used to things, and not turn to increasing the dose too quickly, because that often doesn't help. Certainly, everybody is individual, isn't there? So many different things, but leaving the body time and using lifestyle as well, and usually that is really effective. But there are so many different options. I've had a couple of people come who've been told, there's nothing else. You've used everything. You've gone through things. But when you see someone who's really experienced at dealing with progesterone and progestogens and estrogen, there are so many, aren't there, different options that we could consider. So it doesn't have to be the standard ones. We can prescribe ones that are ones which are recommended by the British Menopause Society, but maybe not first line, maybe ones that would be given for people who have intolerances. So there are things we can do, and we know that HRT has got some lovely benefits with symptom relief and also with bone protection, and it may have benefits depending on when you start it with cardiovascular disease. So we've got lots of things that we know are good about HRT. We just need to try and be flexible and give time and use lifestyle to help anything settle down in the body, so that the balance can then remain good for you.
Yeah, exactly. Yeah, it's that it's looking at all these different pieces of the jigsaw puzzle, isn't it? And not, HRT can do so much, but equally we need everything around it to be supportive. So like you're saying, those small changes, getting out for a walk, practicing exercise, or all the other things that help support physical, mental, emotional health as well. So yes, I know we could talk all evening, couldn't we, about the various different side effects, the pathways, the receptors. But I think we've covered the sort of most important things, and sort of the usual, an overview of the usual things that we'd be approaching in a consultation. I suppose the things for me, I know you mentioned earlier, sort of bleeding. Obviously, if bleeding isn't settling down after that 3 months, please do discuss with your doctor, or if it's very heavy or persistent. And then the other thing, which I'm not sure if we mentioned, but breast tenderness is a very common side effect, isn't it? And sometimes that will usually settle down, and we sometimes recommend evening primrose oil or starflower oil. But if somebody has unilateral, so just one-sided breast pain that isn't settling down, or unilateral one-sided breast enlargement that isn't settling down, then please do see your doctor about that, just so that those sorts of things can sometimes be passed off by us. We think it's our HRT, but actually sometimes those things need investigating, don't they?
Actually, that's really important. Yes, and also to mention that not everything is HRT, and sometimes it's menopause. So sometimes we do see things that we think, well, that is not usual for us. So we want you to have some further tests done. Potentially, if the gut is suddenly, you're starting to develop new gut symptoms after the age of 50, change in bowel habit or any bleeding, we don't want you to think that that could be HRT. Thyroid problems can become more common as we get older, autoimmune conditions. So joint pain is reasonably common when we see when our hormones start to change. But if you have swollen boggy joints or terribly painful joints, we wouldn't want you to assume that that was definitely menopause. So we have to, when we're seeing you, really pick out the things that don't sound right, and then try and look further at why those could be happening or why those aren't getting better. Because the last thing you want to do, I always call it chasing the hormones. You start to want to increase the dose to feel better, but actually it may not be the estrogen. But the easiest thing for us to do when we don't feel well is to turn to doing something. We all want to do something. So we may just try and put on an extra bit of estrogen, or change the dose of what we're already taking, because it's really super easy for us to do that, and we think, well, maybe that will help. But actually what we need to be really careful with is that we don't just go up and down with the dose, that we do take things consistently at the right dose that we've been prescribing, that we do report things that are unusual, so we make sure we don't miss things. It's really a human trait, isn't it, for us to want to help ourselves, and sometimes that might be by adjusting the dose. So it's always worth speaking to your prescriber before you do that.
Yeah, absolutely. So I think we've covered everything that
Yeah.
we intended to, haven't we?
Yes.
Is there anything?
Thank you.
No, I think that's everything. So thank you so much, Carys. It's been lovely chatting to you as always. I'll
Thank
pop
you.
this on the YouTube channel in due course, so you can watch it back or listen back to it there. If you're not following Carys or I on Instagram, then do obviously give us a follow there. We look forward to seeing you in a few weeks with the next episode.
Yes, we'll decide what the next one's going to be. So everything's up on our YouTube channel, isn't it? So it's really easy to see and to look at things, and we can try and put some more things on there. So, but lovely to see you, and Happy New Year to you and to everyone. And we will speak soon.
Yeah.
Okay.
Thank you, everyone. Thank you for everyone who's
Take
joined
care.
us.
Thank
Take
you.
care.
Bye.
Bye
Bye.
bye. Bye.